Hello, Professor. I hope you are doing well today, and welcome to uh, this week's clinical case study on phonation. Uh, so I have my setup right here. I'm recording, and I have my notes a little bit paced around the screen that I have right here. Uh, so, as we get into it, let's begin with the case study itself. So, a little bit of an overview. Our patient's name is Mr. John Thompson. He is 55 years old. He is a police officer, and he has been diagnosed with Parkinson's disease for 2 years now. He's been reporting to have symptoms of having uh, a resting tremor in his right hand. Uh, he has I'm looking at my notes right here because it's a hard word. Bradykinesia, which is a slowness of movement, and stiffness in his limbs. So he has noticed a significant decline in his ability to communicate efficiently, mostly when he's speaking to his colleagues and during any like public interactions. His speech has become softer, monotone, and sometimes difficult to understand, especially in those situations where he's in high stress or fatigue. So additionally to that, he's been reporting that his voice has been getting stuck, making it difficult for him to uh, start conversations and speech, and complete sentences without pausing. So he's got a lot going on. So he's definitely having signs of Parkinson's syndrome because he is diagnosed with that. So he's looking for help from us, from the SLPs, mostly due to his concern about how these speech changes would affect his professional interactions with his career as a policeman, and in his own personal life too. So especially as he frequently uh, needs to communicate with the public and his colleagues during these high stress situations. So he's definitely concerned, and he's rightfully so to be concerned. So with that said, it is clear that, as I said, Officer Thompson is having symptoms due to Parkinson's disease. But what is Parkinson's? So, Parkinson's disease is a movement disorder of the nervous system, and it worsens over time, meaning that meaning that the nervous system, that our nervous system, which is a network of nerve cells, so our neurons, and that controls the many parts of our body, including movement. So, thinking and not thinking of like moving my hands and stuff, that's what it is affecting. Because in Parkinson's disease, these neurons that are in our brain are slowly breaking down and dying over time. So, many of Parkinson's disease symptoms are caused by the loss of these neurons that produce this chemical messenger in the brain, dopamine. So everybody has dopamine. And so this decrease in the dopamine, it leads to the irregular brain activity, which affects the the basal ganglia. So, and what that is, it's a network of those brain cells and nerves, and that's what controls your body's voluntary movements. And so, with that, they basically they approve or they reject those movement signals that your brain sends, and they filter out the unnecessary and incorrect signals. And what Parkinson's disease is doing is affecting that. So it's causing those movement problems and causing those symptoms that Officer Thomas is experiencing. Uh, Another fact that I would just like to share personally, uh, a lot of people know that a big advocate for Parkinson's is the celebrity Michael J. Fox, who was in Back to the Future. So he has did a lot of research and work with that because he has Parkinson's, and he has definitely gone through therapy too to make sure that you know, it is spread what Parkinson's is and how to treat it and stuff. And so, you know, anyway, so Officer Thompson's symptoms are definitely characteristics that you would see and expect for an individual that has Parkinson's disease, as I said. So, in regards to the speech orders, you would notice that the voice and speech changes are often earliest signs of Parkinson's, but not everybody with Parkinson's disease will have the same issues. So, the common difficulties include that soft speaking, that speaking softly, using that monotone voice, slurring words too, mumbling and stuttering and hesitating before talking. And for some people, uh, thinking changes can make it harder too. So like it can make it harder to find, right words that you want to say and focus on conversations or to get the sentence started. It can be a little hard to find your words when you have Parkinson's. And so this can also affect the movements in your body, so it can sometimes limit also facial expressions and or like unintended like body language, which can cause miscommunication. uh, so those are the speech and language things that Parkinson's affects. So with all those characteristics explained, you can see how Officer Thomas's ability to communicate uh, in both a professional and social situation can change just dramatically. So, he may find that his speech sounds too quiet or unclear, or he might notice that, he might have to slow down to make himself more understandable. Basically, he is going to, but has to learn, how to change how he normally talks. And this can be troublesome, in his personal life or in his professional life. I mean, and as an officer, I mean, due to the high stress situations and speaking to the public and everything, you know, that comes with his job, that's going to cause a lot of stress and stuff. So he's definitely going to feel like he has to put more effort into talking and that it's harder to start talking with confidence. So it's going to be a challenge for him, but with the help that we give him, he's going to be able to. He's going to be just fine and bounce back. It's going to take a little bit of adjustment, but he's going to be okay with that therapy. So when we consider, our cultural considerations, you know, uh, how would we approach him to screen him, or in considering his role as a police officer, what it may be his perception of these difficulties. Well, how I would approach him, I would first be very calm and very clear, and I want to make sure that to educate him on how Parkinson's works, and discuss any questions that he might have regarding the symptoms that he is having. As a police officer, maybe we can see if there's a way that he can have some access to some speech and language therapists that he needs. And furthermore, in my paper, maybe discuss some thing about getting some psychological help with a therapist to work through these problems. I would let him know that early intervention is key. So I am really glad that he's, coming to get this early intervention because, we can actually monitor, any of the issues and symptoms that he has, and we can give him and provide him the tools and the techniques on how to manage them. And that's what we want. Most importantly, I want him to know that, it's going to be difficult, challenging at first, because he's going to have to retrain how he has been speaking for his whole, 55 years of life. So that's going to be very challenging. But, through the therapy and through patience and time, he's going to be regaining a new way to speak. That also comes with, a great sense of self-confidence and self-love. So, not only are we helping him gain the ability to speak, we're also going to help him find that confidence and finding his new voice from his old voice and letting him work through those situations. So those are the questions of 1 through 3 that I have answered. This was a very, really interesting clinical case study, and I hope you enjoyed the written part of that as well. So, thank you very much, and hope you have a great day.